Welcome to chapter 26, abdominal emergencies. So let's look at some anatomy and physiology. So the abdomen contains several organs from different body systems. It can cause confusion when determining the cause of the abdominal emergency. We're not necessarily looking for a specific diagnosis. We're just looking to treat the patient. And a thorough assessment is key to that patient. So, abdominal pain in the abdomen, we have different regions. We have the right upper quadrant, the right lower, left upper, and left lower. And it contains organs that provide digestive, reproductive, and endocrine, and also regulatory systems. Okay, so that right upper, lower, and left upper and lower. This is just a general guide to kind of help you determine where their pain is, any kind of tenderness, discomfort, maybe some injury, and any other abnormalities. So the peritoneum is a lining of the abdominal cavity, and then there's the parietal peritoneum. So the peritoneum is both the parietal and visceral. So you have a parietal peritoneum and a visceral peritoneum. The parietal is the abdominal wall. It encompasses all of the organs inside the abdomen. And then the visceral peritoneum covers each organ, kind of like the meninges in the brain. Each one of those, it has layers. So most are enclosed within the parietal peritoneum. There are a few extra peritoneal space organs, such as the kidneys, the pancreas, part of the aorta, and those lie in the retroperitoneal space, which is behind the peritoneum. And then the bladder and front part of the rectum lie inferior to the peritoneum. In females, we have reproductive organs that lie in the abdomen and the pelvis, such as the ovaries, the fallopian tubes, and the uterus. We also have large blood vessels that run in the abdomen. So we have the aorta, the inferior vena cava, hepatic artery, splenic artery, and the iliac artery and vein as well. So when we talk about abdominal pain or discomfort, typically we're going to talk about several different types of pain. So you can have visceral pain, which comes from the organs within the abdomen. Again, remember that visceral peritoneum covers each organ itself. There are fewer nerve endings that allow for only diffuse sensations of pain, and it's more of a dull, achy pain. It can be intermittent or crampy, and it may result from hollow organs. If it's persistent or constant pain, then it originates from solid organs. Parietal pain, so this originates from the parietal peritoneum itself. Remember, it's that sac that covers all of the organs in the abdomen. It has a lot of nerve endings that allow for pain, and it may be easier to locate and describe. It is frequently described as sharp, and the pain is constant and typically localized to a specific area. Tearing pain, this is not a common type of abdominal pain. It does originate in the aorta, and it's caused by the separation of the layers of the aorta from an aneurysm. Retroperitoneal location of the aorta typically causes like a tearing sensation in the back. Ulcers in the stomach can also cause tearing pain. Referred pain, so this is the perception of pain in the skin or muscles at distant locations. So the nervous system has all these different pathways, and sometimes they overlap when they return to the spinal cord. Um, and then that pain may be transmitted to a different area. Like the left shoulder is typically referred pain. Um, you can have pain in the arm, the jaw, the back. Just kind of depends on where those overlapping nerve pathways are. So appendicitis. This is an infection of the appendix. Um, the appendix comes out from the colon, and there's really no use for it as far as we can tell. What happens is waste gets diverted into it, and then it just kind of calcifies and becomes a problem. Um, it can cause nausea and vomiting, pain, which is sometimes referred to the umbilical region. It is followed by persistent right lower quadrant pain. If you have a rupture of the appendix, it is a sudden, severe increase in pain, and then we get these contents that spill over into the abdomen, and this causes peritonitis. Peritonitis is irritation of the peritoneum, usually caused by foreign material, such as a ruptured appendix. It can also be caused by a ruptured colon, anything like that. Irritation causes involuntary contraction of the abdominal muscles, and they'll have abdominal pain and rigidity. Cholecystitis or gallstones. This is inflammation of the gallbladder. It's often caused by blockage of bile flow by gallstones. Symptoms are often worsened by ingesting fatty foods, and it can cause severe right upper quadrant pain or epigastric pain, and sometimes referred to the shoulder. Pancreatitis is an inflammation of the pancreas. It is common in patients with chronic alcohol abuse. Signs and symptoms include epigastric pain and often referred to the back or shoulder. GI bleeding. GI bleeding can come from within the GI tract, the esophagus, anywhere from the esophagus to the rectum. It can be minor or severe, and eventually that blood's got to go somewhere, so it either exits out the mouth or the rectum. It is typically painless. What happens when a patient has pain and GI bleeding, it's typically some type of hole in the GI system from a gastric ulcer. And it will cause severe pain and peritonitis as well. GI bleeds have a specific smell. When you smell them, you will never forget that that patient has a GI bleed. So if it's coming from the upper GI system out the rectum, it will be a dark colored stool, often tarry in color, and it will be a maroon to black. If it's frank blood, that means that it's like a bright red blood, and that means that it's coming from lower in the GI system. If you're vomiting that coffee ground appearance blood, that dark type nasty color, that means it's coming from the lower GI system. If you're vomiting frank blood, that bright red blood, that means it's from the upper GI system. Pain can be absent to severe. We talked about this a little bit, but an abdominal aortic aneurysm is where inside the blood vessel itself, it has those layers of wall, and you get a tear in that inner layer of the wall that goes from the inner layer to the middle layer, and it just fills up with blood. Eventually, it will weaken, and it may eventually rupture as well. So it's progressive, often sharp or tearing pain. It frequently radiates to the back. Rupture causes rapid onset of excruciating abdominal pain. Signs of shock usually present, and with the possibility of unequal pulses. Hernias is a hole in the muscle layer of the abdominal wall. It's usually tissue or parts of organs to protrude up into the skin, against the skin. It may be precipitated by heavy lifting. It may also cause strangulation. So you may get like a strangulated hernia. And it does require, typically, transport to the hospital. Sometimes there's nothing they can do. I know some patients who have an inguinal hernia, causes a lot of pain, and it will, basically what happens is they go into the hospital, the doc puts their hands on it and pushes it back in. And then you can get surgery to fix them if needed. Sometimes patients don't go and get surgery, so because they don't require it because it's a small hernia or something like that. So sudden onset of pain, often following lifting. They may have a palpable mass or lump on the abdominal wall or crease of a groin. Renal colic. So this is basically kidney stones. So it's caused by severe flank pain from the kidneys traveling down the ureter. So with that pain, typically it'll start in the back and the flanks, and then because the ureters come up forward, you feel that kidney stone traveling, and that pain travels, and that's a pretty good sign that you've got some kidney stones. It can cause nausea and vomiting as well. So pain from a myocardial infarction may be felt as abdominal discomfort, maybe epigastric pain, indigestion, or digestive discomfort. So when you have abdominal symptoms, you're going to also consider the possibility of it being a cardiac emergency or a cardiac problem. Okay. The female reproductive system. So the most serious case is ectopic pregnancy. This occurs when a fertilized embryo implants outside the uterus. It can rupture and cause life-threatening internal bleeding. So assessment and care. There are many potential causes of abdominal pain. Our role in these cases is not necessarily to try and figure out what is the problem. Are more focused on life threats and supportive care. Protect yourself from vomiting. Odors. Odors are the big one with abdominal GI system problems. Like I said, GI bleeding has a very distinct smell. UTIs have a very distinct smell. They all have very specific smells. General impressions, so level of consciousness, airway care, early signs of shock, position your patient, consider application of supplemental oxygen if needed. So again, with a history of present illness, you can use your OPQRST because of it being like a pain-related problem. So go through your OPQRST and figure out, use that as your kind of baseline to figure out where it's going. Okay. Specific to females, so where are you in your menstrual cycle? Is your period late? Do you have any kind of bleeding from the vagina that is not menstrual bleeding? And if you are menstruating, is your flow normal? These are all questions to try and figure out if maybe we have an ectopic pregnancy. And with any kind of female, if they are complaining of abdominal pain from the ages of 8 to 80, you're going to ask if there's a chance that they could be pregnant. So again, have you had this pain before? If so, when did it happen and what was it like? Is it possible that you're pregnant, and are you using birth control? And then you're going to go through your past medical history with sample. On a geriatric note, these patients can have a decreased ability to perceive pain because their neural pathways, not their neural pathways, but their nerve pathways are um, decreased and degenerating, so they may not be able to perceive pain as well. They may have a more serious cause of abdominal pain, and it is more likely to be life-threatening, and it may be complicated by other medications. So when we inspect, we look for distension, which is when the belly kind of distends and outside of its normal range. We're going to look for any kind of protrusions, such as like a hernia or a palpable mass or something like that, and discoloration. Palpate. So you're going to palpate the painful area last. You're going to look for rigidity, pain, and guarding as well. Okay. Obtain your baseline vital signs. Some will result in digestive system disorders. Others could be cardiac or diabetic issues, food poisoning, or flu. You're just going to basically provide supportive care and do your airway, and try and help reduce any kind of anxiety or pain as best you can. Don't give them anything to eat or drink by mouth because the patient is going to possibly have surgery, so we want to limit anything that they take in. Again, maintain airway, be prepared to suction for vomiting, administer oxygen to the hypoxic patient, place in a position of comfort. Sometimes these patients want to lay in a fetal position. That's absolutely fine because it helps them get to where they need to go and provides comfort. All right, quick. Any questions, let me know, and I will try and answer those to the best of my ability.